Hello, myself Neha Sagatia, and today we will discuss about pressure sores. Pressure sores are commonly known as decubitus sores also. Mostly pressure sores occur due to constant compression on the one part of body or the skin of the body. Pressure sores lead to loss of blood supply or poor blood supply to the part. Also leads to tissue damage, and there will be formation of ulcer at that part of the area. Pressure sores are commonly occurs in the ICU patients or wheelchair bound patients or bedridden patients. Now we will see some of the common sites where the pressure sores are occurring. It is based on the position which patient has acquired. So first of all, we will see for the supine lying position. In the supine lying position, the most common pressure sore is the sacral pressure sores. Now we will see for the side lying position. In the side lying position, most common pressure sores at the trochanter part. Now for the wheelchair patients or in the sitting position, which are the most common pressure sores are. Now the most common pressure sores on the wheelchair are at the ischial tuberosity. Now the most common pressure sores on the occiput are there, which will be mostly used when the patient is having more pressure on the head side. So now there are some of the risk factors which can lead to pressure sores. So we have to prevent the risk factor for the prevention of the pressure sores. So first of all, there will be immobility. Patient is not mobile or not moved by his or herself, which will lead to compression on the skin. The other is poor nutrition, and the other is immobility. We have discussed poor hygiene, which will lead to pressure sores due to having urine or feces on the skin, which will lead to pressure sores. And the other is loss of sensations, which will lead to pressure sores also. It is most common in the diabetic patients. Also, when we have early signs like redness of skin in the bedridden patients or wheelchair bound patients, we have to keep patients alert, and we need to prevent the pressure sores. Now for the prevention of the pressure sores, first of all, we have to give proper nutrition to the patient to keep patient away from the poor nutrition. Now the second thing will be hygiene. Hygiene is the must for the bedridden patient or wheelchair bound patients. Keep skin clean all the time, or we have to educate the nursing staff which are there in the nearby the patients, and help them to give patients active movements and passive movements daily, check the skin daily. And also we have to tell patient not to move, not to be stable at the one place, change positions. Also use air beds or water beds if possible. So now we will see the management. As the physiotherapy, what can we help to treat the pressure sores? First of all, when the pressure sores are not there, we should prevent it, as we have known the prevention. Now, first of all, we will start with the education of the patients or education of caregiver or family member. We will educate them that ICU patients or wheelchair or bedridden patient needs to change the positions. Also needs to have good hygiene around them. Also needs to have some of the movements, active movements and passive movements. So first of all, we will educate the patient, family and caregivers. Now, what we can do after the pressure sores are occur? As the physiotherapist, we can give modalities such as the laser at the periphery of the pressure sores. We can apply it. Also for the infection, we can give hyperbaremic oxygen therapy to prevent the infection. Now, what are the treatments or what are the movements we can give? So first of all, we will start with the passive exercises or active movements of the patients. If patient is not able to do active exercise, we can go for the passive exercise. Next, we can also suggest patient for the skin care. How to care for the skin. First of all, we will advise patient for the hygiene, maintain the hygiene. Also, we will tell patient to use talcum powder to prevent the friction of the skin. We can advise patient to have a water bed, also for air beds. All we can advise patient to change the positions frequently